We're now going to go to video conference, and we're going to start with Athens, Greece, with Dr. Dimitris Panagopoulos. Welcome, Doctor.
Hello. Thanks for inviting me. I shall try to describe within few lines 10 basic conclusions of our experimental and theoretical work in the University of Athens during the last 11 years regarding the biological effects of mobile telephony radiation. Conclusion number 1, GSM 900 and 1800 MHz radiation from mobile phone handsets is found to reduce insect reproduction by up to 60%. The insects were exposed for 6 minutes daily during the first 5 days of their adult lives. Both males and females were found to be affected. Second, the reduction of insect reproductive capacity was found to be due to cell death induction in reproductive cells. We can see some pictures from, these are eggs from insects. In the first picture we see eggs from a non-exposed insect, and in the second picture we see eggs from an exposed insect to radiation from a mobile phone handset, where we can see the characteristic fluorescence denoting DNA fragmentation and cell death. Many more pictures like this can be seen in the papers distributed in the committee members. Conclusion number 3. The effect in regards to short-term exposures is evident for radiation intensities down to 1 microwatt per square centimeter. This radiation intensity is found at about 1 meter distance from a cell phone, or at about 100 meter distance from a corresponding base station antenna. This radiation intensity is 450 times and 900 times lower than the limits set by the International Commission on Non-Ionizing Radiation Protection, ICNIRP, for 900 and 1800 MHz respectively. It is possible for long-term exposure durations, for weeks or months or years, that the effect would be evident at even longer distances or at even smaller intensities. For this, a safety factor should be introduced in the above value of 1 microwatt per square centimeter. By introducing a safety factor of 10, the above value becomes 0.1 microwatts per square centimeter, which is the limit proposed by the Bioinitiative report. Number 4, the effect is strongest for intensities higher than 200 microwatts per square centimeter. This is when we have the cell phone very close to our head. And within a so-called window around the intensity value of 10 microwatts per square centimeter, where the effect becomes even stronger. This intensity value of 10 microwatts per square centimeter corresponds to a distance of about 20 to 30 centimeters from a mobile phone handset, or to a distance of 20 to 30 meters from a base station antenna. Conclusion number 5. The effect increases with increasing daily exposure duration in regards to short-term exposures from 1 minute up to 21 minutes daily. Number 6, the effect is non-thermal. There are no temperature increases during the exposures. 7, the effect at cellular level is most likely due to irregular gating of ion channels on the cell membranes caused by the electromagnetic fields, leading to disruption of cells' electrochemical balance and function. This mechanism is a non-thermal one. Number 8, although we cannot simply extrapolate the above results from insects to humans, similar effects on humans cannot be excluded. In contrary, they are possible. First, because insects are in general much more resistant to radiations than mammals, and second, because The presented findings are in agreement with the results of other experimenters reporting DNA damage on mammalian cells or mammalian and human infertility. There are many references for these findings in the papers also distributed to the committee. Conclusion number 9, reported observations during the last years regarding diminishes of insect populations, especially bees, can be explained by decrease in their reproductive capacity as I described. Conclusion number 10, symptoms referred to as microwave syndrome, like headaches, sleep disturbances, fatigue, etc., among people residing around base station antennas, can possibly be explained by cellular stress induction on brain cells, or even cell death induction on a number of brain cells. Thank you for your attention.
Thank you very much, Doctor. That was very insightful. We'll now go to the